orientation terms. So we have distal and then proximal. So distal means towards the tip, and then proximal means towards the center of the body. And the leg, that looks like proximal in the center of the body, and then distal out towards the foot, out towards the limb, right? So, and remember, everything is relative. So the knee is proximal to the foot is distal to the knee. The knee is distal to the hip joint is proximal to the knee joint. And then we have medial and lateral. So medial refers to towards the midline, right? The midline is always from like the nose, between the eyes, down through the chin, the throat, the belly button, pubic symphysis, right? That's the midline. On the back, the midline is the spine. So we have medial toward the midline, and then lateral. So the liver and the spleen and pancreas are lateral to the stomach, or lateral to the jejunum, the top of the small intestine, right? Or lateral to the midline. The jejunum, or top of the small intestine, is more medial than the liver, more medial than the pancreas and spleen. Let's see, the pecs are lateral to the breastbone. The breastbone is medial to the pecs. If you're looking at the body, at the limbs, and you're looking at the limbs in anatomical position, then the thumb would be more lateral than the pinky, and the pinky is more medial than the thumb. Although there's a specific term for the hand that we like to use, and that's radial and ulnar. Radial and ulnar. So you guys be sure to be speaking these on your own. As I'm saying these, you should be saying radial and ulnar, medial and lateral, and also touch. So touch where I touch, move the way that I move, and then use the terms that I'm using. That'll really help you a lot. It'll help your brain use more than one area, which will force an additional area, the association area of your cortex, to work to put it together. And then when you go to sleep tonight, your brain literally will start organizing it in a way that's a little bit higher than if you had just read it on a piece of paper or watched me do it. All right, if there are any questions, please let me know. Okay, and then in the back, the spine goes right up the back and the sacrum. So this is more medial and this is more lateral. So if you're looking at like the vertebrae have these points on them. That's the spinous process, and that's kind of how we palpate to feel the backbone. So you can feel the spinous process. That's the most medial. It's right on the center line of all the features. And then on the sides of the vertebrae are the transverse processes, right? So these transverse processes are lateral relative to the spinous process, and the spinal erector group, the longissimus thoracis, and all those muscles, those are all lateral to the spine. The quadratus lumborum muscles are even further lateral to the spinal erector group. The spinal erector group are medial to the quadratus lumborum. Let's see what else. Okay, we have anterior and posterior. So anterior is the front, posterior is the back. It's also called ventral and dorsal. Remember that we always look at the body from the front. This is the front, from the anatomical point of view, right? Anatomically neutral. So this is always anterior. The whole front of the body is anterior. The whole back of the body is posterior. Again, with the arm and the hand, it can be a little confusing because this is the anatomically neutral position. So then this is the ventral surface, and this is the dorsal surface, or the posterior surface, and the anterior surface. The term specific for the palm is volar, V like Victor, O-L-A-R, volar, and it's also we sometimes say palmar. For the foot, there's also unique terms. So for the foot, it's plantar, and then dorsal. Both the foot and the hand use dorsal for the back or the posterior aspect. So this is dorsal and this is plantar, right? So this is plantar flexion and then dorsal flexion. Superior and inferior. I think we actually may have done superior and inferior already. I don't know if we did, but anyway, the sternum is The manubrium is superior to the xiphoid process. The xiphoid process is inferior to the sternum. You know, the clavicle is superior to the rib cage. The rib cage is inferior to the clavicle. If you're looking at the hand, this would be actually, I prefer that you use the terms proximal and distal for the limbs, although technically this would be more superior than the tip of the finger. And this would be more superior, the elbow would be more superior than the hand, but I almost always would say elbow is proximal to the wrist is distal to the elbow. I remember one of the practice questions, keep in mind practice questions on all these, I think I have 4 now, maybe 5 subscriptions to review all these practice questions, and keep in mind that they're all somebody's opinion about, you know, what's going to be on the exam. And one of the practice questions was, you see a client who has a pain in their upper arm. So this is the upper arm, this is the lower arm, upper arm and lower arm, upper leg and lower leg, right? Lower limb and upper limb, upper arm, lower arm. So you see a client who has pain in the upper arm, and it is about, you know, an inch down below the attachment of the deltoid muscle. Is this point proximal to the shoulder joint or distal to the shoulder joint, right? It doesn't say, is it inferior or superior to the shoulder joint? They use the terms proximal and distal. And I think that's going to be pretty consistent.